people think bone surgery is a big surgery. That means they cannot walk for 1 month after the surgery, but it's not real. Actually, it's about twice longer, but like 2 weeks later, it's quite similar with other surgery. Hello, I'm Dr. Kim from the Plastic Surgery. Today, we will cover about the general facial bone contouring surgery in depth.
So taking a deeper dive into the surgical techniques used at the Plus for face contouring. I'm going to talk about the 3 parts.
The facial bone contouring means the facial outline surgery based on the bone. So first one is cheekbone. Usually Asian having the wide and prominent cheekbone. So we make narrower. And also down here, there is jawline. Some people having quite broad chin, like behind here. So want to make it V-line, and or the in front is going to be narrower in facial width on the low face. And the final one is the middle of chin, and it can determine how the patient look. So if it is too wide, we can control make it narrow, and from the side, if it is too retruded, we can make more projection, and if it is too long, make it shorter the other way too. So this is a triple facial bone contouring, including cheekbone, anguloplasty, the mandible angle, and the chin point. So when you take a look at the both side, I did a different way. This side I did the general standard cheekbone reduction, which is making the setback of the cheekbone. And this side, this is our original technique. Like a freed cheekbone is moving like a lip position without any resection. So as you see, the outcome is similar. Like a front side, the narrowing is similar, but from the down here, this side is more advanced, and this side is a little bit retruded, which means like anterior cheek. Usually people worrying about the cheek drooping after surgery, but if we make bone retruded, it's gonna be more severe, and the other side push forward, then it can be supported by the bone. So the cheek drooping, the risk is less. That's the unique point of the cheekbone reduction of the plastic surgery.
So how does the outcome differ depending on the starting bone structure and overall face proportions?
Everybody have a different structure of the bone and the face. So we have to design not only the facial shape, but also we have to think about the eye, the location and shape, size, and nose too. In that case, we have to modulate a little bit. One side is bigger, wider, so we have to do more reduction on one side, the other less. And also, if the patient having the bone dominant problem, then we can solve that problem with the bone contouring. But it's not a bone problem, it's the skin problem. Then in that case, we have to switch it to the patient to another surgery, like a facelift or something. Even they have a small face and a narrow chin and quite good proportion, but outside is not, then maybe we can recommend to reduce the fat of face, or Botox injection for reduce the volume of the muscle. Or if it's too droopy, then we can make a prominent jawline by the facelift. So we have to make a proper indication for the bone, and then we do try my best by the bone surgery. But before we start, then we have to classify, and some people should be excluded, and they have to get another recommendation for the best outcome.
Let's talk a little bit about downtime. What is the patient often underestimate?
So people think bone surgery is a big surgery. That means they cannot walk for 1 month after the surgery, but it's not real. Actually, it's about twice longer, but 2 weeks later, it's quite similar with other surgery. But when you get the resection of the mandible angle, it can cause more swelling. So in that case, it's different. Like a cheekbone only, like a zenio only, or except this one, these two together, it's almost similar with the rhinoplasty, 1 to 2 weeks. But this area is included plus 1 week, so 2 to 3 weeks. So it's not that problem of the downtime. If you walk a lot and you do a facial bend while you're sleeping and elevate sleeping, that can reduce the downtime. So I would say similar but a little bit long.
Talking about the swelling timeline, when can patient actually start seeing the final result?
Every single surgery, I would say 1 month later 70%, and 3 months later 90%, and 6 months later 99%, and even 100% can be obtained. Some people before the 6 months, but usually one year later, everybody get the finals.
When we talk about long-term results, what changes with your face over time and how can aging affect the contouring outcome?
After the bone surgery, bone is hard tissue compared to other skin or the cartilage. So the shape, once it is settled down, will be stay quite long time, like several decades. For example, like eyes droop down in 10 years or 20 years, and nose also tip just droop down as time goes by, but the bone itself will be stay. The covering muscle or the fat or skin can be a little bit changeable, but the bone itself is quite stable.
Are there any risks that comes with this surgery?
There is a saying like no pain, no gain. So there is some risk, but as I said, we can see while we cut the bone, we can see the location of the nerve, so we can away from that. So it's quite safe surgery than you expect. So you don't have to worry about too much. It's big surgery, of course, but it's quite safe surgery too. Don't worry about it. Just come to visit, and if you are quite interested in, just check up with a CT scan. That's the best way to assume that it is good for you or your family. While if you are considering about the bone surgery, then the most important thing is that if you are good indication, so just check CT scan. Then if you are indicated, then just be more like a conservative way, not to resect too much for the long-term outcome. So in that case, then you can have a good result. And also, like if you need more, then you can add another procedure when I do the bone surgery, because I can control the outer, but like a central part here covering with my hand is not controllable with the bone surgery. So in that case, I can do fat graft on forehead, anterior cheek, nasolabial, temple, and even some on the chin point together with a bony advancement. If it is not that enough, or to make a more natural shape, then I can do it. If you get in a proper way, then the synergistic effect can be obtained. So up to now, thank you for joining us and watching a video together. And if you have any comments or the question, feel free to leave a message. And if you have any suggestion, another topic, then I will try to make it. So like and subscribe. Thank you.